Hello, everybody, and welcome to now part 3 of the injury prevention for runners, or even everyday people. And it doesn't have to be just runners. We're preventing injuries for everybody. I'm back with Randy Clark. We're getting into part 3 now. We talked about already trauma, being having the right posture. Now we're going to get into people misusing and overusing injuries. So we're going to get into this segment.
Sure, I'm ready. Let's do it. So misuse, overuse, that's the most common thing we see with runners. Some of the common things we see, like plantar fasciitis, Shin Splints, iliotibial band syndrome, that kind of stuff, even Achilles tendonitis. Those are all kind of runner things. But one of the things we see, especially things like plantar fasciitis, it's not just runners that get that. Right? That can be anybody that can get plantar fasciitis. And so the question then is where is that coming from? Well, first you have to kind of understand what the plantar fascia is. Right? The plantar fascia, there's an arch on the bottom of your foot. Let me grab this here. So there's a couple of arches on your foot. This is what's called the longitudinal arch right here on the inside, the ones that people most think of when they think of the arch of their foot. There's actually a second arch up here called the transverse metatarsal arch. But this one here, as it starts to flatten, there's a connective tissue that runs all the way from this backbone here, the calcaneus, to the front, and that it kind of runs here and helps support this arch. But as it starts the arch starts to flatten, it stretches that tissue, and as it does, the pressure on it, it'll irritate it. And like the itis part of plantar fasciitis is inflammation, right? So you're inflaming that piece of tissue. And now the question is why, right? And a lot of people only get plantar fasciitis on one side. So why is that? Like, why are they're running, right? Are they running more on their right foot than their left foot? Probably not, right? If I'm guessing they're alternating feet like everybody normally does. So why is it that they're going to do this? Well, there's a couple of reasons. One is a little bit about what we talked about last time. If there is something like a structural issue, where let's say one leg is shorter than the other, that can put more pressure on one side than the other side. So something like that. But the thing we see most common with people who have plantar fasciitis is actually something called projection. And what projection is, when you look at someone from the side, right? So turn sideways here, maybe let the camera see your side. You look straight ahead there. So what we're looking at is ear, shoulder, hip, knee, and ankle. Those all should pretty much be in a line when you're standing up. And when you do that, what happens is about 70% of your weight is on the heel and about 30% is across that metatarsal arch, that pad of your foot, right? And what that means is your toes can wiggle. Right? If you're standing, you should be able to wiggle your toes freely. There shouldn't be stress. If there's stress on your toes, the reason is that hip complex, mostly likely the hip, sometimes the shoulder, but it comes forward. It comes forward like this. So the hip actually starts to not line up with the ankle and the knee. And you can even have people way out here with their head and their hip and their shoulders way out here. Now if I try to wiggle my toes, I got no shot. Right? They're gripping in, like they're holding on for dear life in there. And so what happens is all that weight, instead of resting back there on that calcaneus in the back, is now resting towards the front of the foot. And what that causes is that arch to start to flatten out and stretch. And that repeated strain on that tissue causes it to get inflamed. And that's plantar fasciitis. And so even though it's a foot problem, the very first place we look at when someone comes in with that is up at their hip. Right? Because if their hip is way out here and they can't wiggle their toes when they're standing, we know exactly where it's coming from. And all I got to do is bring that back, let that tissue heal up, and they're back and running again.
Another common injury we see in American Running Company are shin splints. Tell us a little bit about shin splints.
Oh, shin splints, yeah. Let's talk about painful. Those things can be really painful. And that goes into a little bit about what we're going to be talking about in the next segment is the proper footwear. Proper footwear is a big deal with shin splints. Is that a lot of people, when they're impacting the ground, they're just not doing it very well. And that puts stress on two tissues in the body. One's the tibialis posterior, which runs right on the back of the shin, and one's tibialis anterior, which runs right on the front of the shin. And the tibialis posterior, I can say that again. The tibialis posterior, so if this is the front right here, on the back, it's this red connection right here. That's where it attaches on the back of the shin right there. And it attaches into this, the bone has the skin around it called the periosteum. And where this attaches, it starts to stress this so much that it starts to pull that periosteum away from the bone. People with shin splints, if you take your thumb and you rub up along this muscle, it doesn't feel smooth like this. It feels super bumpy.
Oh, wow.
And it's because they're starting to pull that periosteum away from the bone, and it's creating inflammation right along the bone itself. So every time they hit, and this particular muscle's job is to plantar flex, so it pushes the toes in. So every time you go and push off with this thing, you're activating tibialis posterior and pulling more away from that bone, and it's just super painful.
Okay.
And can take a really long time to recover from if you don't treat it properly. But if you can get in there and smooth that out and then take the pressure off of that muscle, the periosteum can heal, and then they're back and working again. So, but this is not the easiest muscle to get to, so it's really easy to miss if you have somebody just rubbing on this, because you got to really wrap around and get to that attachment, because it's the attachment that's causing the problem.
See, I'm learning new stuff today too, along with everybody at home.
All right.
And lastly, I want to get into is about another issue we get people commonly with IT band problems.
Oh, IT band problem, sure. So IT band, right, as you might know, runs all the way from the head of the fibula all the way up to the top of the leg here, and then it ties into two major muscles. There's two muscles that tie into the IT band. One is called the tensor fascia lata. It's up here in the front and comes back and ties in and goes down. And the other one is your glute max, right? It's back here, comes in, ties in. And so you have this like a front and a back support coming into the IT band. The IT band acts as a shock absorber to the body, right? That's kind of its big job. Think about the shocks on your car, how they kind of go up and down to kind of smooth the ride. IT band does a lot of that. So when you land, it uses TFL and glute max to absorb a lot of that shock, so it doesn't run all the way up and doesn't cause your neck to tighten up or anything like that. So what we do with IT band syndrome, you can't just treat the IT band, right? Because you really got to go through and treat the muscles that tie into the IT band, and then look at the footwear, look at how they're running, look at the gait to make sure they're not coming down too hard or too far lateral on that side, which is putting all that lateral pressure onto the leg and then causing it to tighten back up.
There's someone that heel strikes. Could that be a?
Oh yeah, because heel strike is when you get the most impact, right?
Yeah.
That's when the foot hits the ground, and if you're running, you've launched yourself and then are hitting the ground, right?
Yeah.
And so when that heel strike happens, that's when that shock wave runs up the leg, and if you're not doing it properly, pretty quick it's going to tighten up IT to the point that it's starting to hurt you.
That's why we try to promote midfoot. I mean, heel strike is,
Yeah.
being a
Oh yeah,
therapist.
midfoot at least spreads it out a little bit instead of putting it all in that small spot there.
Cool.
Absolutely.
Segment 4, that's it for segment 3. Segment 4, we'll get into the proper footwear and concluding ending to this whole segment.
All right, thanks, CJ.
Thank you.
Yeah, absolutely.